Well, if you're one of the estimated 7 million Americans with it, you probably know that help is usually limited to bracing or surgery.
But for Holly Davis, the alternative is something called structural integration. It's a new twist in scoliosis treatment.
You'd never know it by looking at her, but Holly Davis has scoliosis. And a couple of years ago, she tweaked her bad back while exercising. Doctors told her something she didn't want to hear.
I went to different doctors, and I went to all the top doctors in the Metroplex, and they all kind of said the same thing, that I needed spinal fusion.
At 45, the answer to that was an easy no.
And to be my age and to be physically active, the idea of being kind of just pinned down in my back and blocking my ability to move was not an option for me.
Holly also turned down pain medications and steroid injections, and then after lots of research, she found the Solberg Center for Structural Integration. I'll let Michael explain. He's the expert.
What we're doing is working with the body in a way to release and organize the connective tissue.
In Holly's case, it's all hands on deck. Michael and therapist Sage Ann gently push and pull. Michael says most scoliosis therapies focus on the spine. Structural integration, on the other hand, focuses on the area around the spine. He uses a pillowcase to illustrate.
What needs to happen is the decompression and taking the strain and pressure off the spine.
Awesome. So I'm going to have you engage the backside and kind of push this hip bone forward.
Sage then takes Holly through something called neuromuscular re-education.
So this is good for Holly because of her scoliosis binding on her left side. So we strengthen the right side of the core and generally redirect the tissue on the left side.
Michael says one patient had a 32% curvature of the spine reduced to about 8%. Holly says she felt relief immediately.
I'll never forget the sensation of being able to put my feet on the floor and actually feel equally both feet on the floor.
Through all the twists and turns, Holly says she's very happy she took the alternative path.
I'm not over the hill yet. There's still a lot I want to do.